Braille-Institute is a nonprofit organization whose mission is to eliminate barriers to a fulfilling life caused by blindness and severe sight loss. We provide an environment of hope, encouragement, and empowerment through integrated educational, social, and recreational programs and services. Braille-Institute was started by a blind man in 1919, a Montana cowboy in fact, who taught himself to read Braille. Our founder discovered that there was a dearth of Braille materials in this country, so he set out as his mission to make them available. The innovative spirit demonstrated by our founder is the hallmark of our organization, which continues to this day. Our services have expanded from free access to Braille materials to hundreds of free classes, seminars, and one-on-one consultations that transform the lives of visually impaired men, women, and children. Kites rise highest against the wind, not with it. When Sir Winston Churchill said these words, it was in the turbulence of a world at war. The turbulence of our times poses its own unique set of challenges. The accelerating winds of change, evidenced by rapid advances in technology and global economic crises that affect our daily lives. At the same time, the needs of blind and visually impaired people of all ages continue to evolve. In order to determine our future, Braille-Institute has completed a strategic planning process to chart the appropriate course for us in the years immediately ahead. This project involved a broad array of clients, donors, volunteers, staff, and board members, sharing their opinions and giving their guidance, helping us determine how best to set our kite against the wind. The plan contains 4 broad goals, which frame the 8 overarching goals that will enable Braille-Institute to focus our precious resources on areas of greatest impact. These broader goals are organizational capacity, sustainability, visibility, and programs and services. Braille-Institute will invest in our capacity to support programs in terms of staffing, infrastructure, and governance. This calls for better use of technology and more collaboration with other organizations to leverage our efforts. We will broaden and diversify funding and revenue sources to ensure our continued financial stability. Braille-Institute will improve our visibility and broaden the understanding of what we do and the impact we have on our clients' lives. We will enhance our visibility through strategic partnerships, marketing, and education of vision-related and medical providers at all levels, as well as universities. We will broaden the depth of clients, volunteers, and donors. Braille-Institute will enhance our programs and services to meet the needs of clients, respond to new trends and opportunities, and maximize our impact on the lives of visually impaired people. We will focus on improving and promoting childhood Braille literacy and enhancing and expanding the spectrum of adult programs to better serve the diverse and changing needs of the visually impaired people at different stages in life. Innovation will continue to be a central theme of our programs and services. While a plan in and of itself is only as good as the implementation, we are beginning a transformative process. Those who will turn to Braille-Institute tomorrow and in the years ahead will continue to find the life-changing programs and human spirit that have become our hallmark. They will also find an organization fueled by its imagination, energized and responsive to life in the 21st century. It is often said by organizations that are familiar with Braille-Institute that we are innovative because of our flexibility and the effective use of resources. We assess the upcoming trends and meet the changing needs of our clients sooner than others. We focus our efforts to be a mission-driven organization. Braille-Institute knows how to develop relationships that extend our reach and effectiveness as an organization. We have strategic partnerships with area professionals and local, regional, and national organizations. One example of our success with being flexible, using resources effectively, and leveraging relationships is the National Braille Challenge. The Braille Challenge is the only national academic contest for blind students in the U.S. It includes participants from 43 states and 4 Canadian provinces. It was designed to encourage students in 1st through 12th grades to value the importance of Braille literacy, to motivate them to improve their reading and writing skills, to reinforce specific skills needed for success in the classroom, and ultimately to gain employment. The National Advisory Board for the Braille Challenge not only provides oversight to the overall event, but also ensures that we are addressing Braille literacy issues. These members are comprised of experts in the Braille literacy field from the US and Canada. Some of these issues they have raised and addressed are as follows. Braille literacy has been on the decline for decades, having dropped from 40% 50 years ago to 10% today. Yet, research shows that out of the 25 to 30% of blind adults who gain full-time employment, 90% are Braille readers. Newer technologies have increasingly supplanted Braille. Sophisticated devices that magnify print, recorded textbooks, and audio computer files have become accepted norms for accessibility to information. But Braille is as critical as print. A blind student who doesn't master Braille is unable to take his own notes, easily scan or refer back to needed information, or effectively process complex material such as higher math. It's also the only way a blind student can process information at the same speed as a print reader. Writing and spelling ability come from reading skills. In focus groups led by the National Advisory Board for the Braille Challenge, teachers have told us that older students typically develop an over-reliance on computer programs that translate text into Braille. This masks the fact that many students aren't keeping up their Braille skills. Through the Braille Challenge, teachers have a compelling reason to get back to the basics of Braille reading and writing accuracy. It also has impacted public perception. In 2006, we tracked 56 broadcast and print stories written about the program. Last year, we tracked 208. Each article educates the public about the importance of Braille and the abilities of these students. Also, as the regional events have grown in size and scope, the average size of 20 is now up to 100, they too have extended greater awareness to sighted school administrators, public officials, and other community decision makers. The Braille Challenge and the relationships we have leveraged on the local, state, and national stage has changed the paradigm because it has brought a low-incidence, sometimes isolated population together in the name of academic excellence. Braille-Institute is an effective organization because of a combination of fiscal discipline and innovation with a strong staff and volunteer base. We have a strategic plan process that really works. It's not just a book on a shelf. Our innovative spirit infuses our programs and services, which is balanced by our effective use of resources from mostly private funders. Light Magazine is the annual report for the Braille-Institute. Within its covers, we present the revenue generated during the course of the year, as well as the outcomes data collected during service provision. Braille-Institute also has an annual audit process and our active board of directors who provide excellent fiscal oversight. We have a rigorous outcome assessment process with data that covers output of all of our programs and services, as well as the impact of our services on our clients. This data is reviewed by staff yearly to inform programming and evaluation decisions and to continue to meet the changing needs of our clients. Lastly, our strategic plan has an operational plan with SMART objectives: specific, measurable, achievable, realistic, and time-bound. This will inform the implementation and evaluation process for the next 5 years. The public may not fully understand our impact on changing people's lives. The public perceives sight loss as an enormous barrier to living an independent, fulfilling life. But we know that this doesn't have to be. Our clients often come to us with little or no hope, and in time discover that there are virtually no limits to what they can achieve. We see this time and time again. A misperception people have of Braille-Institute is that we serve only people who are blind. That's not true. In fact, only about 10% of our students and clients are totally blind or have been blind since birth. The vast majority of those we serve are formerly sighted or have some level of residual vision. There are many causes of visual impairment in today's world, including macular degeneration, glaucoma, diabetic retinopathy, and cataracts. Notably, as the population ages and people live longer, more people will experience age-related vision loss or vision loss due to the progression of chronic diseases. This means the need for our services will continue to escalate for years to come. Another misperception people have of Braille-Institute is that we only teach Braille. In truth, teaching Braille is only a small part of what we do. We are a recognized leader in providing specialized library services to blind, visually impaired, or physically disabled individuals. We are the largest Braille publisher on the West Coast. Our education and rehabilitation programs for children, youth, adults, and seniors are unsurpassed. We are an international leader in the promotion of Braille literacy, and we serve as an international resource for people seeking help or information about low vision wellness services. Each year, we serve more than 75,000 people across the country and through our 5 regional centers and nearly 250 community outreach programs. All of our programs and services are provided free of charge. Many, if not most, nonprofit organizations charge fees for their services. That means that our myriad of programs and services, from one-on-one low vision consultations to classes for visually impaired seniors, to helping families parent young children, to providing library services to thousands of blind and visually impaired patrons, are all free. Actually, we like to say that our services are not free, but rather that they are priceless. Braille-Institute is not reliant on government funding. We rely almost entirely on the faithful generosity of individuals, corporations, foundations, and fundraising groups to support our programs and services. In fact, less than 3% of our funding comes from government sources. By limiting government funding, we find that we are able to minimize bureaucracy and enjoy the freedom to focus our resources where they are needed the most. Vision loss is not selective. We help people of all ages who are blind or visually impaired. Our clients bridge all ages, infants to seniors, all backgrounds, ethnicities, and cultures. Braille-Institute prides itself on sound financial management. We are known and respected for being a long-standing, prudent steward of our financial resources. Our cost efficiencies are excellent compared with similar organizations. We spend approximately 80% of every contributed dollar on direct services and the remainder on support services such as facilities, fundraising, and administration. This cost efficiency is made possible, in part, because of the unmatched selflessness of our volunteer workforce, nearly 5,000 strong. Such solid financial management has allowed us to weather economic downturns, meet urgent needs, and plan for the future. Braille-Institute is one of a kind. Compassion and caring guide us. We are passionate about what we do, and it shows in our work with clients and their families. Our staff and volunteers possess exceptional skill and knowledge. We truly care about our clients and are committed to helping them to achieve their goals. In fact, we don't think of Braille-Institute so much as an organization, but rather as a very large family. Braille-Institute is recognized as a leader in low vision wellness services because of its numerous innovations. We have a history of beginning new endeavors, expanding those that are useful, and discarding those that no longer meet the needs of our clientele. Our achievements are many. Here I'll highlight just a few. After the founding of Braille-Institute in 1919, our founder perfected the interpoint system of Braille printing, which allowed Braille to be embossed on both sides of a sheet of paper. On the surface, this may not seem important until you realize that Braille-Institute's first printing of the King James Version of the Bible consisted of 21 volumes, standing nearly 7 feet in height. The interpoint system effectively halved the size of many books and publications, making them comparatively much more transportable. In 1929, our founder successfully lobbied for federal legislation to fund the production and distribution of free Braille materials. His efforts resulted in what is now known as the National Library Service, which prints and distributes free Braille materials for qualifying individuals. More current accomplishments include, in the year 2000, Braille-Institute established the National Braille Challenge, a unique academic competition designed to promote Braille literacy among blind and visually impaired students, ages 6 to 18, in the U.S. and Canada. The only national or international competition of its kind, the program has won numerous honors and has helped thousands of children improve their Braille literacy skills, which are essential to their future academic, work, and life success. In 2008, Braille-Institute launched a program called El Poder Sin Ver, or Ability Without Sight, to help fill a critical gap in the low-vision healthcare needs of older Latino adults in the Los Angeles community. Met with overwhelming success, at the heart of the program are promotoras, grassroots educators who are respected members of the Latino communities served by Braille-Institute. Our Latino initiative is expressed in our regional centers in unique ways and through specific partnerships that fit the needs of their Latino clients. Cane Quest is one of our newer programs. Similar in concept to the National Braille Challenge, Cane Quest is focused on developing blind and visually impaired students' orientation and mobility skills, in essence, their ability to travel independently. Given that the success of our youth is dependent on not only their academic achievement, but also their ability to integrate seamlessly into the workforce, emphasis on independent travel skills is critical. Met with tremendous initial success, we look forward to this program also expanding to other blind and low vision service organizations throughout the country. Braille-Institute has some challenges or vulnerabilities that we continue to face. One of them is visibility. The news is a 24-hour cycle now, bombarding people with information overload. The challenge is to cut through the clutter to get our message heard. We're developing a renewed marketing and education plan through our strategic planning process that will address this challenge. Another challenge or vulnerability for us is the current economic climate. Braille-Institute has come upon this challenge in the past. We were founded just before the crash of 1929. We are unique among nonprofits, especially in our field of expertise, in that we derive the majority of our funding from private donations. But because of this, we are subject to the rise and fall of the economy, and in turn, the ability of private individuals and organizations to donate, which is always a challenge for a nonprofit. The sustainability goal within the strategic plan will be addressing this concern. Braille-Institute provides direct service throughout Southern California, which has a large geographic sprawl, making efficient transportation either by staff or clients an issue. We continue to develop innovative ways to address this concern. We provide transportation for new clients on a rotating basis within the various counties. We provide outreach on wheels, mobile solutions, to take our services to outlying communities. We are expanding our ability to provide long-distance services via the website, internet, social media outlets, and YouTube to connect our services to the people who find these modalities more convenient than battling traffic congestion, or for those who are homebound. Braille-Institute has many partnerships within the medical community. Historically, we have received referrals from ophthalmologists and optometrists. This approach has served us well, but does not provide the broad reach we want to impact. Teaming up with various medical providers, especially those who provide managed care modalities for chronic disease, allows us to interact within the vision care continuum, with the ultimate goal being low vision wellness for clients at any stage of vision loss. However, with the current economic crisis keeping people out of work, more individuals are without access to medical and health resources, so reaching out to people both inside and outside the medical community through a variety of human and social service partnerships is important. The Braille-Institute strategic plan sets the course for the next several years, and it will direct how we manage and lead change in the field and in our provision of services. Currently, we are prioritizing our operational plan for the organization. These priorities will need additional resources to realize the fulfillment of the plan. Technology to support our infrastructure, as well as our newly developing programs and services, are surfacing as our most pressing need. Reaching a broader base of clients, volunteers, and partners through increased visibility in the form of marketing and educational materials will also be a priority in supporting the changing needs of our clients. And of course, Braille-Institute's plans for implementing different modalities of service provision will be the center from which all priorities will revolve. Braille-Institute has gaps in service that we have identified through the strategic planning needs assessment process. Some of these gaps include expanding nationally the availability of information and education via website to parents of preschool-age children with visual impairment to support them in meeting the developmental milestones of their children. El Poder Sin Ver, Ability Without Sight, our Promotora-driven program for Latino elderly who are visually impaired, being expanded in every way throughout the state and nationally. Broaden the reach and scope of the Braille Challenge within its different components. Within Braille literacy, expanding the special collections, a library of Braille reading products, to pre-reading visually impaired and blind children. Provide more orientation and mobility services in all of our regional centers using contract and bilingual staff. This is the most basic skill that provides independence to visually impaired people, the ability to get around their home, neighborhood, and town safely and efficiently. This is especially important when a person has lost their driver's license due to vision loss and feels hopeless that they will not be able to get around and live their life. Contract with occupational therapists to build a low vision referral network within the system of service that already exists. Occupational therapy is a complementary service to providing low vision wellness, especially since occupational therapists, or OTs, primarily make home visits. We can provide low vision training to OTs to supplement their own services, thereby providing enhanced holistic services to clients in their homes.